Because if I come to you and say कि sir मेरे घुटने में बहुत दर्द है, so then what would be your next question is what I want to understand.
If you consider it for knee pain, usually when the patients complain of knee pain, we ask them specific questions like ये pain कब होता है. So the most common activity which patients suffer pain is using stairs, climbing stairs, coming down from stairs, sitting on the floor, getting up from the floor. If they are sitting for some quiet time on a chair and when they get up, they experience pain. Pain while walking is an advanced feature. It develops when you have advanced arthritis. But when you have early pain like 3 to 6 months history, with the knee pain, usually it comes with some specific activities. Most common problem which we see is a back pain. In my practice, find a reason for back pain is sedentary lifestyle. Obesity is one of the reason and severe vitamin D3 deficiency. And in old age patients, osteoporosis. Weak bones, fragile bones, that can also cause back pain. The classical complaint which patients tell when they come with the heel pain is सुबह उठने के बाद 4 कदम नहीं चल सकते, थोड़ा चलने के बाद ठीक लगता है. Once they say this line, the diagnosis is very clear. It's plantar fasciitis. You don't need to do any test and you can offer directly them treatment.
What's the longest kind of tenure that people tend to suffer and then approach a doctor?
The area where I practice is a tier 3 place in India. I see patients who have been suffering from knee pain since last 15-20 years. आप जब तक डॉक्टर से मिलेंगे नहीं, डिस्कस नहीं करेंगे, because every patient is different. Some patient is having post bypass surgery, post angioplasty, severely diabetic. So we need to discuss with your doctor regarding the specific issues which can create complications. Usually with the robotics and the change in the dynamics of knee replacement, patients recover in 1 month. But if you compare it with the conventional traditional approach and what we were doing 5-10 years back, those patients were definitely taking 3 to 4 months to recover. Only 10% of the patients they need surgery. 90% patients we manage with physiotherapy, medications and injections. Knee pain, hip pain is a very broad term. बहुत अलग-अलग प्रकार की बीमारियां होती है, अलग-अलग एज होते हैं. जब वो हमारे पास आते हैं, उनसे कुछ स्पेसिफिक क्वेश्चंस पूछते हैं, कुछ टेस्ट कराते हैं, ब्लड टेस्ट, एक्सरेज, एमआरआई. And hardly 10%, like I see 50 patients in my OPD daily. I advise surgery to hardly 4 or 5 patients.
After all this global exposure, you chose to come back to Gondia, which is your hometown, right? उसके पीछे आपका वो decision लेने के पीछे का आपका motivating factor क्या है?
बड़े शहर में resources, डॉक्टर, हर चीज readily available. Like डॉक्टर अभिषेक ट्रेनिंग करके मुंबई जाए या ना जाए, मुंबई में जॉइंट रिप्लेसमेंट सर्जरी ऑलरेडी होता है, नागपुर में होता है, गोंदिया में नहीं होता है.